There is a skull sitting in the Musée de l'Homme in Paris. It is around 7,000 years old, and it has a hole in it, a clean, deliberate 2-inch hole, scraped through the bone by a sharp piece of flint. That hole was not made after death. The bone around its edges shows something that stopped 19th century surgeons cold. It had healed. Whoever owned that skull had a hole cut into their head and then kept living. For years, possibly decades. The year was 2024 BC. No, actually, much, much earlier than that. Here is what nobody told you in history class. Your ancestors were performing brain surgery before the wheel existed. Before writing, before farming had spread across most of the world, they were opening human skulls with stone tools. And in some places they were doing it so well that their survival rates put Civil War-era hospital surgeons to shame. This is the story of Trepanation, and it is one of the strangest, most shocking things the archaeological record has ever handed us. The word comes from the Greek for to bore. The procedure is exactly what it sounds like: cutting, scraping, or drilling a hole into the human skull. Modern neurosurgeons still perform a version of it today, using titanium instruments and general anesthesia in sterile operating rooms. The original version was done with flint, obsidian, or sharpened seashell. No anesthesia, no germ theory, no understanding of what the brain actually did inside that skull, and yet people survived. In 1865, a man named Ephraim George Squier, an American archaeologist, brought a Trepanned Peruvian skull to the New York Academy of Medicine. The audience of physicians looked at it and refused to believe it, not because they doubted that the surgery had been performed. The evidence was obvious. They refused to believe the patient had survived. Their own success rate with the same procedure, using metal instruments in the mid-19th century, rarely broke 10%. Hospital infections killed most of their patients before the wounds even closed. The skull Squier showed them told a different story. The bone at the edges of the hole had regrown, smooth, rounded, healed tissue. The patient had not just survived the operation. They had gone on to live long enough for their body to begin repairing the damage. Squier asked the most eminent French surgeon of his era, Paul Broca, to examine the skull. Broca's conclusion was blunt. Indigenous peoples of South America had been performing advanced surgery long before Europeans thought to look. What followed that moment changed everything. Archaeologists thought they understood about prehistoric medicine. Once researchers knew what to look for, Trepanned skulls started turning up everywhere. France, Germany, Russia, China, Peru, the Pacific Islands. More than 1,500 Trepanned skulls from the Neolithic period alone have been found worldwide, representing between 5 and 10% of all cranial remains from that era. 5 to 10%. That is not a rare experimental ritual. That is a widespread, practiced medical procedure. The oldest confirmed case comes from Ensisheim, a village in the Alsace region of France. Archaeologist Kurt Alt and his colleagues found it in a 7,000-year-old burial site. A man approximately 50 years old with 2 distinct holes in his skull. Both holes showed smooth, healed edges. No surrounding fractures. No signs of trauma that would have caused the openings. This was not an accident or a wound. Someone had deliberately cut into this man's skull twice, and he had survived both operations. At one point in the same site, 40 out of 120 skulls recovered showed evidence of trepanation. 40. Picture the person who did this. They had no operating room, no bright lights, no scalpel. They had a piece of flint that they had spent hours sharpening to a precise edge, and enough accumulated knowledge passed down through direct practice, not books, to know exactly how deep they could go without hitting the tissue underneath the bone. They knew the anatomy by feel, by experience, and by watching what happened when someone got it wrong. They worked slowly, scraping a few millimeters at a time over what must have been hours, while the patient remained still enough for the procedure to succeed. Think about what that stillness required from the patient. No anesthesia means fully conscious. The pain of bone being scraped away from the inside is not something with a modern equivalent, and yet they stayed, because the alternative, the unrelieved pressure, the bleeding inside the skull, the seizures, the loss of function, was worse. Someone had told them this worked. They had seen it work. They trusted the procedure enough to hold still while a stranger cut into their head with a rock. Here is the detail that stops most people when they hear it. Some of the skulls found at Neolithic sites in France had multiple holes, not from multiple individuals from the same person. There are individuals in the archaeological record who underwent trepanation more than once. Their skulls show 2 or 3 healed openings, each surrounded by regrown bone, each representing a separate surgery that they lived through and recovered from. One of the skull fragments found near the burial sites had a small hole drilled through it. Researchers believe these bone discs cut from living patients may have been worn as amulets. The bone from someone's own skull strung on a cord carried as a charm. The reasons for the surgery are still debated. In Peru, where more Trepanned skulls have been found than anywhere else on Earth, over 10,000 of them, anthropologist John Verano at Tulane University spent decades analyzing the evidence. His conclusion was that the majority of cases were practical medicine, treating head injuries from battle, removing bone fragments from skull fractures, relieving the dangerous pressure that builds inside the skull after a severe blow to the head. You did not need to understand Nenorkeo to observe that a man who took a club to the skull was suffering, that his behavior was changing, that he was dying, and that cutting into the bone and removing a disc sometimes made him better. But some skulls showed no trauma at all, no fracture, no wound, nothing that modern forensic analysis can identify as the cause. These were operations performed for reasons we cannot fully read from the bone alone. Possibly epilepsy, possibly severe headaches, possibly symptoms we would today recognize as neurological disorders. Whatever the reason, someone decided that cutting open the skull was the answer, and in a significant percentage of cases they were right. Here is the number that should genuinely shock you. Researchers at the University of Miami led a 2018 analysis of more than 800 Trepanned Peruvian skulls spanning nearly 2,000 years from 40 BC and through the Inca period. The long-term survival rate, patients who lived long enough for the bone to show clear healing, was around 40% in the earliest cases. By 1008, that number had climbed to 91%. 91%. These were not flukes. These were practitioners who had studied the procedure across generations, who had identified which techniques caused less bleeding, which approaches avoided the membrane beneath the bone. How to clean the site, how to position the patient. They had developed expertise that would not be matched in Western medicine for centuries. Compare that number to the Civil War. American surgeons in the 1860s, using metal instruments and formal medical training, achieved long-term cranial surgery survival rates that averaged well below those of the pre-Columbian Andean surgeons working 1,000 years earlier with stone knives. This is the part of prehistory that almost no one talks about because it does not fit the story we are used to telling ourselves. The story where human beings started out fumbling and helpless and gradually, slowly, painfully figured things out until we arrived at the shining competence of the modern age. That story is not wrong exactly, but it leaves out the chapters where the fumbling had largely already stopped. Where the knowledge was real and specific and refined and effective, it leaves out the 50-year-old man in Alsace who walked away from 2 brain surgeries with nothing but flint and survived long enough for his skull to grow back. The next time someone tells you that ancient people were primitive, that before writing, before metal, before cities, human beings were just stumbling through the dark, barely holding on, remember this. There are skulls in Paris with healed holes in them. Healed, not the holes of injuries or accidents or death, the holes of surgery, deliberate and skilled, performed by people whose names we will never know, whose techniques died with them and had to be relearned centuries later, by people with far better tools and far worse outcomes. They did not have textbooks. They had something harder to build and easier to lose. Direct knowledge, accumulated carefully, passed from hand to hand across generations in the specific physical language of cutting bone and watching what happened next. You are watching this on a screen that required 10,000 years of accumulated human ingenuity to produce. But somewhere in that same chain, 7,000 years before this video existed, a person sat down with a sharp piece of stone and opened a human skull and made it home. The hole healed, the bone grew back, and we are still finding the evidence.